This legislation deals with 1/6 of the American economy, over $3 trillion. And by definition, it impacts every single person in this country because we all at one time or another need health care. You might think that a piece of legislation of such significance would have numerous hearings and discussions. What do doctors feel as to how this legislation would impact their ability to serve their patients? How do nurses feel about this legislation? How do hospital administrators feel about this legislation? How do advocates for senior citizens or people with disabilities feel about this legislation? This legislation is so bad that the Republicans have refused to hold one public hearing, and all of their deliberations are behind closed doors. That's how bad this legislation is. And I say to Senators Grassley and Ernst, if you don't believe me, then why don't you listen to virtually every major healthcare organization in this country, all of whom oppose this legislation. You have the AARP, the largest senior group in America, saying this legislation will be a disaster for seniors and older workers. You have the American Medical Association, the doctors who treat us. They say this legislation is a disaster. You have the American Hospital Association worried to death that if this legislation passes, rural hospitals all over America will shut down. You have the American Cancer Society opposing it, the American Academy of Family Physicians, the American Heart Association, the Catholic Health Association. You have virtually every major healthcare organization in America saying to the Republicans, do not go forward on that legislation. Now, all of us know, and there is no debate, that the Affordable Care Act, so-called Obamacare, is far from perfect. No one argues that. No one argues that deductibles are too high, that co-payments are too high, that premiums are too high, and certainly nobody argues that the prices that we pay for prescription drugs are much, much too high, and that we've got to take on the greed of the pharmaceutical industry. No one is debating that, and what the American people understand is that the sensible way to go forward is say, okay, what are the problems? Put them on the table. Let's debate them. Let's see how we can address them. What the American people are saying about the Republican proposal is that they are begging their members of Congress not to go forward. You know what? The last poll was done by USA Today, and you know what percentage of the American people support this Republican plan? 12%. And I suspect it's because those 12% have not examined what's in this bill. This is the most unpopular piece of legislation ever brought forth in the modern history of America. You remember the bailout of Wall Street? Enormously unpopular. This legislation is even more unpopular than the Wall Street bailout. So how can Republicans go forward with legislation opposed by virtually every major healthcare organization, overwhelmingly opposed by the people of every state in this country? And the answer comes back to a crisis which is even deeper than the healthcare crisis, and that is the role that big money plays in American politics today. Brothers and sisters, our job is not only to defeat this disastrous proposal, and we got a lot of work to do in the next few days, but our job is to join the rest of the industrialized world and guarantee health care to all people as a right, not a privilege. Unbelievably, at a time in which we have 28 million Americans today, this is before the Republican legislation, 28 million people with zero health insurance. If the Republican legislation passes, there will be over 50 million people without any health care. And what we have got to ask ourselves and what we have got to demand that Congress address is a very simple fact. How is it that the country I live next to, I live 50 miles away from the Canadian border, how come Canada can provide health care to every man, woman, and child in a much more cost-effective way than our dysfunctional system? How come the United Kingdom and Germany and France and Scandinavia and Ireland and every major country on earth can understand that in the year 2017, health care is a right of all people? Our immediate task with regard to health care is to defeat this horrific legislation. But as soon as we accomplish that, I will be introducing legislation which is gaining more and more support all over this country for a Medicare for all single-payer program.